We know that up to 77% of women may have fibroids in their lifetime.
My name is Darlene Jacobson and I'm from Raleigh, North Carolina.
I'm Stephanie Eford and I am 38 years old, single.
I've been married for 25 years.
75% of the time these fibroids go silent. They're asymptomatic.
I like to exercise, work full time, just enjoy life to the fullest.
And you don't often notice them until they become large enough to start pressing on other organs, bladder, bowel, and just making your belly feel distended. Every month the period just starts to get heavier and heavier.
I was having a lot of problems with my period, heavy bleeding, and extreme fatigue.
The stomach issues that I was having was actually impacting my lifestyle, and I was constantly aware of where the restroom was located in any type of restaurant or when I was traveling.
So every day I would come home from work and I was so fatigued. It was an unbelievable weakness, it really was. I'd have to take a nap.
I would come home from work and take a nap just to get through the evening and then go to bed.
Women that prefer to continue with watchful waiting or expectant management tend to feel like they need to tolerate their symptoms or not complain about it because they feel like their only option is going to be major surgery.
I didn't want to whine or complain. I didn't want to seem needy or, I couldn't take it, that kind of thing.
It's hard. It's a hard thing to be having such heavy bleeding, to keep going day to day.
After a year, and when it was starting to really impact everything, the daily routine is when I actually went and sought extra help, a specialist.
I went to my gynecologist and she said, I feel you have a fibroid tumor. I had an internal exam. And then she's recommended a hysterectomy. I've
been an overall healthy person my entire life, so I wasn't quite sure how to react, and a little shock. And I asked, what is uterine fibroids, and what are, I guess, the procedures to remove the uterine fibroid? Is it dangerous? The only possibility that my regular OBGYN could offer me was a hysterectomy.
I didn't want a hysterectomy.
When it comes to determining the ideal candidate for MRI-guided focused ultrasound, there are two major factors to consider. One is the patient, her lifestyle, her reproductive stage, her desires out of life, her symptoms. And then the other part of it is the fibroid characteristics, so the size of the uterus, the number of fibroids, the blood supply to the fibroids, and the location. So those two need to come together to find the ideal candidate for focused ultrasound.
I had probably 2 pages of typed questions, and Dr. Behara in the first consultation, first meeting, spent well over an hour answering every single question, very patiently.
First thing she did was give me a hug.
I'm a hugger. I'm more of a touchy-feely kind of doctor, I guess.
I'm telling you that maybe at that time in my life, I needed that hug.
I can't remember exactly, but when they show up and they're distressed and I see tears, it usually helps just to start with a hug and just say, it's okay, here's some tissues, let those feelings out, and let's talk about it. There are options, and that's why I'm glad that you're here.
Well, once I got the information, went over it with Dr. Behara, I felt just determined to get these things out of me. That's what I wanted. I wanted this over with, and I wanted to move on with my life. I'm tired of dealing with this right now. I just wanted to take care of it, and I felt that the focus-guided ultrasound was the way to go.
The technology of focused ultrasound has been around for years and years. It's the addition of the MRI guidance is really what makes this a novel technology, and really is what allows very focused treatment, more safe treatment of these fibroids, and is essentially the knifeless surgery that we're talking about.
And then you lay down on the bed when your stomach is submerged in water.
The ultrasound beams travel through water very well.
Then you have beams, ultrasound beams to go through the water, and are actually aimed at your fibroid.
I think it's a very engaging procedure. Every time you're delineating your treatment area or you're doing a little sonication and talking with the patient, you're involved. The time passes, I think, for both the patient and myself. That was a great one. There you go.
After the procedure was over, you just kind of take a moment to regroup and get your breath, and you are able to dress yourself. And I actually waited in the waiting room for a little bit, just to let some of the medication wear off. And I had a family member to drive me home.
You know, I think it makes sense the way these women are describing. They feel like their fibroids are melting away or becoming softer, and technically, once we ablate that tissue and achieve that temperature where it's destroyed, you're basically taking that fibroid that's a solid, more hard, firm mass and turning it into something that's more pliable or softer.
I felt better the very next day. And that's because what was happening with my iron deficiency anemia and the problems with my blood, it was all gone now because of the procedure.
Immediately I have more energy, and actually now I've changed my routine, so I'm working out at 5 o'clock in the morning. And the color's better, they tell me, my friends and family, you know, you just look better, you feel better, so, and I do.
I would recommend this procedure to anyone because it's so important to have a choice, but the most important thing is that you can have your life back.
MRI-guided focused ultrasound takes minimally invasive almost to another level. It's completely no incisions and nothing is invasive about it, and I think that's what women really like about the procedure.